now is a very exciting time in pediatric dentistry and the oral health of children, because there are so many things that can be done to ensure that kids actually don't get any cavities. It's entirely possible for them to get no cavities, and it starts with babies. It's important that once a baby has a tooth, and the average child gets a tooth around 6 to 7 months old, so somewhere starting at around 6 months after getting that tooth is really when the work begins for trying to protect those teeth that have come in and trying to prevent gum disease going forward. And what are the things that parents can do? Well, first is they can be thoughtful about what they feed their children. Of course, food items that have a lot of sugar in them just sit on the teeth and promote dental decay. There's very little reason for children to drink anything but milk and water. And even milk sitting on teeth can be bad. So for instance, once that tooth comes in, no baby should ever go to sleep with a bottle in their mouth. Parents can wipe the teeth. You don't use a toothbrush in a very young child, it's just too hard to maneuver. But babies love to have their gums rubbed, and you can just use a cloth with it. And in the morning and at night, at least twice a day, go ahead and rub the teeth until that baby's at an age where you can begin to think about a toothbrush. And what kind of toothbrush should you use? It should be a soft toothbrush. Nobody should ever use a hard toothbrush or a medium toothbrush. That's for cleaning silver or trying to get your bathroom clean. Soft toothbrush is what you want to use in the mouth. A lot of parents ask me, why is it that we should be using a toothbrush? And it's mostly because you want to get the kids used to the idea of having a toothbrush in their mouth. Because when they get older, of course, you're going to expect them to do it themselves. How much toothpaste is the right amount? That's also a big question. And simply put, the amount of toothpaste for a very young child, probably before the age of 3 or 4, is the smallest amount that you could possibly put on there, because really all you want is a little bit of flavoring. Once the child gets to be a little bit older, you're going to put about a pea-sized amount onto the toothbrush in order to help with the toothbrushing. The last thing maybe we should talk about in response to your question is that going to the dentist is an important part of this process. And the first dental visit should be about 6 to 12 months after the first tooth appears. And that's really more of a get-to-know-you kind of visit. And for the dentist to look in the mouth, tell you about how the teeth are coming in, and give you advice about things to be done. It's an important visit. And the pre-visit by you as a parent should be not to talk about, oh, how much I hate the dentist, or any of those kinds of things. It should be, this is going to be for someone to look in your mouth. It's going to be fun. Nothing bad's going to happen. Dentists are very sensitive to young children, and they know that the first couple of visits have to be all about fun, and certainly not about anything